Awesome. So thank you so much for joining today for Gender Affirming Forms and Data Collection. I'm going to go ahead and get started, and the training today is interactive, so I encourage folks to come off mute to ask questions in the chat, because I hope that we can come to some collective understanding of the information that we're pulling together. So the first thing I want us to do is think about and imagine the trans and non-binary people that you may be working with. It may be helpful to write down the kinds of folks that you might be working with so that you have something to come back to as well. But really, we're going to be thinking about keeping in the start of our mind's eye the trans and non-binary people that we normally would be seeing in our services. So think about, what are their ages? What are their races? What are their ethnicities? What is their economic background? And what is their citizenship status? So with this sort of like avatar of the folks that we might be working with in our mind, I want you to keep that person in mind, or keep that trans or non-binary person in mind as we go through aspects of today's training, because I think it will help us to understand where folks may or may not be able to answer in certain ways, and how the way we collect data and information may be more or less affirming. And now I have a question for you all that is not rhetorical, which is, when and how are you currently collecting name and gender information about clients? So feel free to come off mute, or you can put your response in the chat. So I see Hector said in medical care records. Okay. Dakota says through application process with our program. Melissa says when completing an application and electronic health records. Okay, so that was my assumption, is that we would be collecting either through an electronic health record, or that we'd be doing some sort of application or health history. So that's what predominantly we're going to be talking about today. And then LaShonda, you said when we talk to patients directly. Yes, so that in any sort of like application process or communication with a patient, we'll be acknowledging the patient that we're working with, or the client directly. Awesome, thank you all so much. So a little bit about me. My name is Miss Jai. I'm the founder and CEO of Toadhenge Consulting. Our mission is to help health professionals learn about trans and non-binary health through training and technical assistance, in order to reduce health disparities and maximize health potential for trans and non-binary people. I use feminine and masculine pronouns, and I identify as a trans, non-binary, queer, poly, kinkster, and a community organizer for trans and non-binary health. I currently reside in Arizona and have worked in public health for the last 12 years, specifically supporting trans and non-binary people through HIV prevention and care programs. So that's a little bit about where I come from. I would love to hear who's in the room, though. So if you could please introduce yourself in the chat with your name, the pronouns that you use, and where you are calling in from, so we can get an idea of where everyone's coming from. Hi, Dakota. Thank you for calling in. Hi, LaShonda. Thank you for being here, Bianca. And thank you for being here, Macy. Hello, Melissa. Hi, Gray, all the way from LA. Thank you for joining. Hi, Hector. Good to see you. Thank you all so much for being here. So I'm really excited that we're getting a chance to share information across state lines as well, because I think the information is applicable to all of us. And is it Andy? Am I pronouncing it correctly? Your name correctly?
You got it. We were in the same cohort for our MPH, so I'm so excited to
Oh,
be here because I'm familiar with your work and I just love you. So I'm excited to be here.
thank you. I appreciate you being here. Okay. Well, thank you all so much for being here. As I said at the beginning, you can feel free to come off mute, or you can put responses in the chat, but we'll go ahead and jump in. So this is what we're going to be going over today, our learning objectives. We're going to be achieving this by going through some foundational language, specifically the differences between gender identity, expression, and sex at birth. I'll be using that language a lot throughout today's discussion, so I think it's important for us to have clear definitions of what those mean. And then we will be going through some gender affirming and gender neutral language we can use both in medical settings as well as when we are working with a client or a patient around health assessments or the ways that we might be engaging with folks. And then finally, we're going to look through some actual forms themselves and like snippets of forms to talk about what can be improved on the forms, what we might want to look at, and how that might be specific to the folks that we're working with around how in depth or not in depth we want to go. I do think it's important to mention that there's a lot of recommendations on how to standardize forms. And I found that a lot of those recommendations are um, not inconsistent, but they're just like slightly nuanced differently. So I think it's important for us to figure out something that works specifically for the clients or patients that we're serving, and then making sure that that is then standardized across our organization or across all of the folks who are doing engagement with our clients. So to kick us off with language and terminology, I'm going to start with a question for you all. Can someone give me a definition of what gender identity is? You can put it in the chat or you can take yourself off mute. And a quick note about this, we can move as quickly or as slowly through the foundational language as we want, but because I could just sit here and talk all day, but the faster we move through it, the more we can get to the forms and stuff too.
Gender identity is what somebody identifies themselves as, and it's not necessarily male or female. It's just whatever they feel comfortable with.
Yeah, thank you, Dakota. So it's how someone internally identifies, right? So when we think of gender identity, it's how a person internally and individually experiences their gender. And so these are someone's thoughts, their feelings about their gender, and how it aligns with or is different from their sex assigned at birth. And that gender identity is not outwardly visible to others at all times. And Dakota, I really appreciate you bringing up that it's not always necessarily male or female as well, right? It's how we relate to our own gender and how we see our own gender identity. What about gender expression? What is gender expression?
So it's when a person expresses their gender on the outside and what they present as that day.
Yeah, absolutely. Thank you so much. And Melissa, I saw you answered the gender identity question as well. Thank you for that. So, gender expression is how we externally express our gender through our behavior, through outward appearance, such as dress, hair, makeup, body language, and voice. A person's chosen name and their pronouns are also ways that we are commonly expressing gender. So it's important for us to keep in mind like which pieces of information that we're collecting. But this tells us a little bit about how someone expresses their gender. And then what is SOGI an acronym for? Does anyone know what SOGI stands for? I'll give you a hint. It has to do with data collection. Aha. Gray, you said it, sexual orientation and gender identity. And LaShonda followed it up, sexual orientation and gender identity. Awesome. So I might use the shorthand SOGI, meaning sexual orientation and gender identity. Generally, we hear it SOGI data collection or SOGI data. And it is a requirement for us to collect it if we're doing health services in a lot of the areas that we're serving. And then what is TGNB an acronym for? Awesome. Thank you, LaShonda. Transgender non-binary. So again, just a way for us to have sort of a shorthand around when we're talking about the gender expansive community, people who are trans and non-binary. And yeah, we're talking, I might say TGNB, and that's just what that means. Awesome. So we know that human experiences of attraction and identity are much more nuanced than one categorical label, right? As we can see from some of the pieces that we've talked about already, when we think about trans and non-binary people, there are lots of ways that our lives are nuanced. So we might be nuanced based off of the age that we are. We might be working with folks of different races and ethnicities. We might be working with folks who have a gender identity that doesn't match their gender expression. So it's important for us to make sure that we're being mindful that when we are working with folks, that we recognize that not everybody is able to express their gender in a way that feels in congruence with their gender identity because of things like safety, the inability to access specific services around gender affirmation, et cetera. And that the because of this, it's also important to remember that while we have definitions for this language, and we might say things like transgender or non-binary um, or other SOGI language, that the actual experience someone may have is unique when compared to the experiences of another person. So I may use the language genderqueer to identify myself, but that doesn't mean that someone else who identifies as genderqueer uses it in the same way or has the same expression or identity as I have. So it's more so that we can understand that the community is not a monolith and there's lots of ways that we might experience these identities. We also include here other other genders when we're talking about gender expression, right? Because we might have folks who express their gender in non-binary ways. So either that could be a combination of masculine and feminine aspects, or we might have folks who express their gender in an androgynous ways, or try and express their gender an agender expression devoid of gender identity, or devoid of gender expression. So there's lots of ways that we might show up in the world. So before we move on from foundational information, the difference between gender identity and gender expression, what questions do you all have about this foundational language? And if you have no questions, you can just put a 1 in the chat. Okay, sweet. I'm seeing some ones come through. Wonderful. There's one term we didn't describe yet, which is sex assigned at birth. Can anyone give me a definition of sex assigned at birth? Okay, so Dakota, you said male or female. Can you expand on that a little bit for me?
Sorry, my button's hiding. Sex assigned at birth is what the doctors give you based on your genitalia.
Yes, absolutely. So it's the legal gender marker that's put on our initial birth certificate based on a visual inspection of our genitals at birth. And so our sex assigned at birth does not always match the reality of our biological sex, and it doesn't always match our gender identity. So when we're saying sex assigned at birth, we're talking about what's on our original birth certificate. Also knowing that there are some spaces where we can have birth certificates changed to a legal gender marker that is not the same as our sex assigned at birth. And there might be some states where we're not able to get that document changed. So that can also change how we're collecting information. Wonderful, thank you. So now let's talk a little bit about gender affirming and gender neutral language and what that means in our clinical and non-clinical aspects. So first, I want to ask for someone to give me a definition of what are pronouns. I've mentioned pronouns a couple times. I asked folks to share what pronouns are, but this is a way for us to think about if you had a client come to you and say, what's a pronoun? How would you describe it to them?
Pronoun is a way to refer to that person in a form they're comfortable with.
Yeah, it's how we refer to the person in a respectful way, right? In a way that is comfortable, but also is respectful of their identity. We can also say something along the lines of, we can't always assume someone's identity by the way that they look. And so this is a way that we are making sure to refer to the person in a respectful way. So I would love to hear from someone who is not Dakota. Dakota, you're doing a great job, but I'd love to hear from someone who's not Dakota around why do we ask someone's pronouns? What's the purpose behind that? Okay, so LaShonda says not to offend someone. Absolutely. Why else?
To be respectful of their I guess just their individuality.
Yeah, thank you for that, Melissa. So it's an opportunity for us to be respectful of their individuality. It's also an opportunity for us to let trans and non-binary people who are accessing our services know that we are safe people to talk to about their identity. So if we ask someone their pronouns, it may not necessarily feel safe for them to for that person to share the pronouns that match their gender identity in that moment. But we've sort of planted the seed that we're willing to have conversations and meet them where they're at for their identity. And then Bianca answered LaShonda's question. Awesome. Thank you. So gender expression may not match identity, normalizing sharing pronouns for safety and to avoid outing for trans individuals. Absolutely. And Bianca, you bring up a really good point, which is that we standardize asking pronouns of all folks, not just the folks that we visibly believe are trans or are part of the gender expansive community, because we want to make sure that we aren't making assumptions, right? We're not singling out trans folks so that we say like, oh, you look trans, so I'm going to ask you your pronouns now. We don't want to single out trans folks. But also because there are lots of folks who identify as non-binary. There are lots of folks who identify along the spectrum of gender identity, and we can't just base their identity or assume their identity based off their gender expression. So this is a way for us to also be respectful of folks who might not have access to expressing their gender, who it might not be safe for them to express their gender in a clinical setting or in their services that they're seeing, or who might live in communities or neighborhoods or with family where it's not safe for them to express their gender in the way that they feel. So it's a way for us to standardize across the board for that. Awesome. So I think the other thing for us to keep in mind is that pronouns help us to better connect with all of our clients. So it helps us to avoid making these assumptions. It shows them that that the services we are providing are dedicated to respecting them as individuals and to make sure that their health needs are getting met as well. So we're asking folks their pronouns so that we can also make sure that we're getting their health needs met. So what are some ways that we can ask pronouns? And I'm going to move through this kind of quick because I want us to get to form so we have an opportunity to talk about that in more detail. So it doesn't need to be complicated. We can ask pronouns in a couple of ways. So we can introduce ourselves and say what our pronouns are. So at the beginning, I said, my name is Miss Jai. I use masculine and feminine pronouns. I might also say, my name is Miss Jai. I use she, her, and he, him pronouns. And then I might follow it up with one of these questions. So what are your pronouns? What pronouns may I use to refer to you? What pronouns do you use? We can also collect the information in the ways that we are collecting data from the get-go before we even have a conversation with our client, right? So we could include pronouns on our registration forms. We can ask and verify pronouns either through registration or through initial check-in at every visit. And this is important for us to keep in mind. Why might we want to ask at every visit someone's pronouns or ask someone their name and pronouns at every visit?
Pronouns and gender identity can often change.
Yeah, we're not a single moment in time. None of us are a single moment of time, right? So it might be that we find we're on a gender journey for ourselves. We're trying to find a name that fits for us, that reflects who we are internally. We might be trying to find a pronoun or a set of pronouns that feel more comfortable for us. And so if my physician saw me a year ago and I come back now, I might not be going by that name any longer, or I might not be using those pronouns any longer. So by checking in at regular intervals, it gives us the opportunity to be adaptable to the realities of gender expression that folks have. And then the other thing is that we might also see that changes occur in legal name and legal gender marker as well. And so if we're asking this information on a regular basis, then we're making sure that the legal documentation is also getting updated. And then I also see that LaShonda said that it creates safe space and it may change as well. Yeah. So the other part of that is the safety component. So if I go to see a physician, I establish care, I might not feel comfortable sharing at the first visit my pronouns or the name that I go by because I don't know how they're going to respond to trans clients or trans patients. And so it might take a couple of visits for me to warm up to a point of being able to say, this is the pronouns I use or this is the name that I go by. Wonderful. Thank you. So now we're going to talk a little bit about name, because name is also a way that we can affirm our clients. We can be gender affirming and also just client centered in the care that we are giving. So I want us to think about the legal aspects of gender. So when is it necessary for us to collect legal name and legal gender marker? Feel free to put it in the chat or you can take yourself off mute. And there's the question. And this can be specific to your organization or specific to the role that you play as well when you are collecting legal name and gender marker. So Dakota, you said when reporting to a government office, sometimes, yeah, it might be required for us to collect a legal name or legal gender marker. Lashonda, you said in partner services, we have to do it every time we see a patient. Okay. Melissa said when filling out official forms such as insurance. So that's a big one, right? If we're billing insurance, if we're really billing is the biggest one, then we need to have the legal name and the legal gender marker of the person because we want to make sure that it's being billed correctly. I'm also seeing that Ryan White applications, any medical clinic, rapid testing, sometimes booking travel. Yeah, so those are all locations as well. Like booking travel, we want to make sure we have legal name, we have legal gender marker because those need to be utilized and we need to show proof of that when we're engaging in travel. Any medical clinic, again, similarly, we want generally that's around billing as well. Rapid testing, similarly, it's so that we can follow up with folks, especially if there's a reactive. We want to make sure that we're able to follow up with folks. And this came up actually in a training I did last month with the Pima County Health Department, where they were talking about the fact that they have to collect legal information when they're doing any testing because in order to get folks into Ryan White services and do rapid start as well. And then Gray, you said when matching past records or records across institutions, absolutely, because we want to make sure that those do combine so that we're not missing medically necessary information. Absolutely. So first, I want thank you so much for sharing those. And now I want us to think about when can we use someone's current name and pronouns even when they don't match legal documentation. So when in our services can we use someone's current name and pronouns when they don't match legal documentation? Awesome, thank you, Melissa. So when we're talking to the client, absolutely. When else? So Bianca said, any other time speaking to them or about them or non-legal documentation. Yeah, so that was really what I was hoping to get at was like when we're speaking about a client as well, making sure that we're using the name that they go by and the pronouns that they use. And really whenever we have non-legal documentation. So I think about when we say like government forms or official documentation, if we're having to collect that legal information for the form, or if it's not clear, then we should get verification if that's necessary. So if it just says client first name, client last name, it's a good opportunity for us to ask, are you asking about the legal name for this person? Are you asking about the name they currently go by? So we can verify what it is that folks are looking for, because we need to also be able to make sure that our systems are adaptable. And then I saw that there were a couple of additional comments. So when referring to them, when talking to someone else, yeah. So let's say I'm working on a clinical health team. I'm a case manager and I'm working with a physician and I'm working with a pharmacist, and we're all providing clinical care to one individual. If I'm talking about this patient to the physician and the pharmacist, then I would use the name that the person goes by and I'd use the pronouns that they use as opposed to using their legal information in those moments. It's also a good opportunity for us to point out and like prepare the other folks on a medical team or on a care team if there are pronoun changes or name changes to let folks know, hey, this person's legal name is X, they go by this name, so we'll be calling them by this name. So it's an opportunity for us to expand on that a little bit. But the other thing is that it helps us practice. So we're less likely to misgender or misname someone to their face if we're practicing the pronouns that they use and we're practicing the name that they use. And so when we're using it outside of to talk about this individual as well for the purposes of necessity amongst care, then it gives us the opportunity to practice. And if we make a mistake for us to correct it in the moment still, but not make the mistake to the face of the client, which can end up doing more harm. Does that answer your question, Dakota? Okay, cool. I think it's important for us to think about the legal aspect of providing services because this is where a lot of us get stuck. If we're required to collect legal name and gender marker on paperwork or with a service, then it can be difficult for us to not just default to that legal information when we're talking to the client or when we're working with the client or patient. But unfortunately, getting name and gender marker changed on documentation can be time consuming and financially difficult if it's even legally allowable for the individual. So what that means is that we have trans and non-binary people in our services whose legal name does not match the name they go by and whose legal gender marker doesn't match their gender identity. And then on the flip side of that, we might have folks who need medically necessary services who have a legal gender marker that's different, or that has been changed already. And then it becomes more difficult for them to get those medically necessary services. So I think about for folks who have an M on their identification but need a cervical screening, then it might be more difficult to get insurance to cover that cervical screening. There might be more issues with actually getting those pieces billed correctly, or there might be kickback from an insurance because the legal gender marker has been changed. So we see for trans and non-binary people that that there are a number of issues that happen, whether or not that legal gender marker has been changed. And then by thinking about where and how we're collecting this information and how we can use it, we can begin to train ourselves to default to current name and pronoun instead of just what is on legal documentation. So I encourage you to look at the forms that you use in your daily basis or your EHR and think about where you're collecting that information, and also if that information is transferring amongst organizations or amongst systems. So now we're going to talk a little bit about gender affirming and gender neutral health language specifically. I know that there are a number of folks who are on here who are doing HIV prevention and care services. You may or may not be working in a clinical setting. This gets a little bit clinical, so take what is helpful from this section. And this could be also an opportunity if you're working with a clinical provider to provide some additional language or to share this information with them as well. So when we are working in a medical or a clinical setting, there are some terms that are inherently gendered in the language that we use. And because of this, it's important for us to be mindful of the language we use in our health assessments and the discussions we have with our clients to move toward more affirming and neutral language. So first, we want to use language that respects the identity of the individual. So language should reflect the gender identity and sexual orientation of the person who is sitting in front of us. So when I say reflect the gender identity, I mean if someone is sitting in front of us and they identify as a man, regardless of their sex assigned at birth, then we'll refer to them as a man. So we would, if someone says I identify as a transgender man, then that we're using that language first, that gender identity first language. So this is a person who identifies as a man. Similarly, if we have someone sitting in front of us who identifies as a woman, then we would use language for someone who identifies as a woman. So we want to reflect the identity of the individual. Language should also, we also do this by reflecting the language that is used with us. So if someone uses specific language for specific parts of their body, then reflecting that same language back to them. So if I ask someone what language they use for their chest, what language they use for their chest, and they say, I use breasts, then I might say, okay, have you had a breast exam in the last 12 months or in the last 2 years or whatever that assessment might look like. So I'd reflect the same language back to the person that has told us what language they use for parts of their body. We can also move to more gender neutral language. So this is things, and focusing on the anatomy health, but we can move to more gender neutral language. So using language like partner instead of boyfriend, girlfriend, husband, or wife. We can use language like like sibling if we're doing a health assessment or trying to find out, like, do you have any siblings that have experienced cancer or diabetes? Have you had any parents who have experienced cancer or diabetes? Things like that. We can move to a more gender neutral language as we're doing our assessments. And then with anatomy health, this is another way that we can approach assessment, is that we can focus instead on the anatomy of the individual as opposed to the gendered language. So we might use the language chest to start instead of language like breast, because breast already has a feminine gender attribution to it. We might say cervical screen instead of a pap smear. So these are ways that we can move from what is already considered or like we might not use well woman exam, we might say cervical screening instead. So it's ways that we can move our language over from a gendered language. This is especially important when we're working with transmasculine and non-binary assigned female at birth people, because we see that so much of the health disparities for those communities are things like avoiding getting cervical exams, challenges getting cancer screenings, issues with seeking services. or assumptions about their body, and those assumptions being that they're cisgender, so then not getting services for the organs that they currently have. And then similarly, we can, like I said, we can ask people what language they use. So it could be as simple as having like a list of like, this is the language we use, or I'm going to be doing this kind of an assessment. What language do you like to use for these parts of your body? And that's a way that we can also prep folks to have these conversations. And then finally, when talking about prepping folks around these conversations, we also should seek to get holistic consent. And what I mean by that is asking for permission before we discuss sensitive information, expressing to our trans and non-binary people, but really to everyone, why we are collecting this information and what it's going to be used for. I think about any like HIV testing information that I've collected or sexual health information that I've collected, and how there's been this expectation of I'm going to start talking to you about the gender of your partners, the types of sex that you're having, whether or not you're using prophylactics, whether or not you're on any medication, birth control, et cetera, et cetera, et cetera. But before I launch into all of those things, I might say, we're going to be talking about some sensitive topics today. I'm going to be asking you about sexual behavior. I'm going to be asking you about the gender of your partners. Are you comfortable having that conversation today? So we put autonomy back into the hands of the individual by letting them make the decision to engage, but also by letting them know why we're collecting that information. And that's important because trans and non-binary people have lots of trans and non-binary people have experienced the curiosity of a provider, and had really invasive questions asked of their body and asked about their body that weren't related to the care they were trying to receive. And so by prefacing it with why we're collecting that information and that it is necessary for the services we're providing, we're letting folks know that we're not just asking out of sheer curiosity, or treating the person in front of us like an oddity. Any questions about that language so far? And if no questions, you can just put a 1 in the chat. Awesome. I'm glad this is really helpful. And this is also like a really brief kind of like crash course around it as well. We only have an hour together. I do master classes that are much longer so that we have an opportunity to actually get into the nitty gritty and actually go through the forms that you have as well. Okay, so the last piece around language that I want to bring up before we jump into forms is that there is an opportunity for us to revise outdated and offensive language as well. So as health providers, it's important for us to change as language changes with the populations that we serve, and move from outdated and offensive language to more inclusive and affirming language. So instead of language like real sex, real gender, or genital sex, we would say sex assigned at birth. Instead of using the language a transgender or tranny, we would say transgender person. So again, transgender is an adjective, it's not a noun. Instead of transgenders, we'd say transgender people. Some of the other ones that I see pretty frequently are like FTM and MTF. And so this language is, again, it's bioessentialist. It's saying like it's putting the person's biology first, and specifically their sex assigned at birth first. And as I mentioned earlier, we want to move towards language that is gender identity first. So we might say transgender man, transgender men, as opposed to FTM or used to be a woman or born female. And similarly, we might say transgender woman or transgender women instead of MTF, used to be a man or born male. This is sometimes challenging to change on our forms, and especially forms that are not controlled by us. So I think about statewide forms where we're filling out information. I think about federal forms where we're filling out information. So if we know we need to collect these specific categories, then I encourage us to look at how can we change the forms we do have control over so that we are able to then funnel folks into these categories, but we're able to collect more expansive information. Or if we have to use this exact form, how can we preface that information with the client who's sitting in front of us, letting them know that we know that this is not the language that they likely would use for themselves. And then instead of things like sex change, preoperative or postoperative, we would say medical transition. We also know that folks socially transition as well. So you might hear that language used frequently where folks say I've socially transitioned, meaning they might be going by a different name, they might be going by a different pronoun. or they might be addressing or expressing gender in a different way. So that could all be socially transition. And not everyone who's trans or non-binary is interested in medical transition. And so it's also not painting with a large brush saying like everyone is eventually going to get surgery or get on hormones. We know that medical transition is not the journey for everyone. And then instead of saying things like homosexual or sexual preference, we'd say sexual orientation. And we just use more specific language. So instead of homosexual, we'd say gay, lesbian, bisexual, or queer. Okay, so now we've gotten through all the language pieces. How are folks doing? Can I get a thumbs up if you're still on board and you're still here and you're still excited? Okay. All right, I'm seeing a couple thumbs up. I'm seeing a couple more thumbs up. Great. So now we're going to talk specifically about forms and data collection. In this section, I've given you some language that we've talked about. I've given you some things that we should think about when we're collecting information, like legal versus current identities, legal versus current name, things of that nature. So now we're going to go through a couple of examples. And we're going to start with an example, and then I'd love to hear from you all what you think could be shifted or changed for it. So here's an example of the beginning of a form that clients may have to fill out when they're scheduling services, or they may have to fill it out in the clinic or as part of billing information. So what are some of the things that you notice about how name and gender are currently collected on this form? You feel free to unmute or you can put it in the chat. Okay, so it doesn't differentiate between legal name and affirming name, absolutely, or the person's current name. What else? Okay, so it looks like it's open answer, that there are no options. So that might actually be, it might be preferential, right, to have an open answer as opposed to a finite list of options. What else? LaShonda said, would it be important to include sex at birth or would that be too much? So that is a great question. What do folks think? Is that an important question or an important piece of information for us to collect? Mother's maiden name, wondering why that question is necessary. Yeah, same. What do folks think? Should we include sex assigned at birth on this form? So Grace says gender and sex are distinct. I think both should be collected. Yeah, one of the best practices is to have a two-step gender identity data collection. So asking someone's sex assigned at birth and asking someone's current gender identity. Or current gender. And so that's a way for us to, because a lot of folks who are trans may also not say, I'm a transgender man, or I'm a transgender woman, or I'm transgender non-binary. They may say that their gender is that they're a man or they're a woman, right? And so when that happens for our data collection and is being inputted into our systems, if someone put on this form that they were a man, how would that then translate into our system? What would happen with that?
I think it would be assumed that the person is cisgender.
Yeah, it would be assumed the person is cisgender. And then when we are pulling information to find out like how many trans people are we serving? What are the health experiences of trans people? Do we have trans people in our clinic that are actually getting services? Then this is a person that will automatically be filtered out of that. So we'll be missing the experiences of this person. And this is what we see happening with, I keep going back to HIV because that prevention and care is my background, but that's what we see with HIV surveillance. And especially in Arizona, we can't talk to how many people are HIV positive and trans in the state of Arizona because our surveillance and the way that we're collecting our data is not collecting it accurately. So when we don't collect sex assigned at birth, this can occur. The other piece is that if we collect sex assigned at birth and we collect a person's current gender, does that mean that we can that we know what someone's legal gender marker is?
No.
No. So if we know that at some point we're going to be billing for a service, that we're going to need to link this to identification, anything of that nature, then it's important for us to delineate between someone's legal gender marker and someone's current gender identity as well. Because what I've seen happen is that someone, let's say that my sex assigned at birth was male, and so I had an M on my original birth certificate. If my current legal gender marker is F and I identify as a trans woman, if I don't have a place to put legal gender marker, the assumption might be that my legal gender is still the same as my sex assigned at birth. And so then we have issues with billing. Then we have issues with these other pieces. So since we're not clarifying what we're asking for, that's one of the challenges. But part of this is like, why are we collecting the information? So if we're not billing for a service, we don't need to know the legal gender marker of the person because we're not going to be submitting to insurance. It doesn't need to be connected to an identification, etc. And then the other piece is that our pronouns aren't collected, right? So if I am a physician and I receive this form and I'm preparing to greet this patient, I'm automatically going to have to ask questions about pronouns and introduce myself with my name and my pronouns so that I can get a better understanding of how this person likes to be referred to in a respectful way. If I put that on the form from the get-go, then I might be saving myself a step. And I can start from the get-go of saying, like, I just want to verify these are the pronouns that you use. Or I saw that you filled out that the pronouns you use are this on the form. So those are the pronouns I'm going to use with you. So it's a way for us to start thinking about how we can reduce the chances of miscommunication. So now I want us to take a look at a second example. And I want to ask you, what do you notice is different about how the second example collects information?
They're asking for pronouns and sex marker.
Yeah, so they're asking for pronouns. They're asking for their sex marker, which in this case would be a legal sex marker. What else is different? Oh, Melissa, are you speaking?
Can you hear me?
Yes.
They're doing an explanation up front. And so, kind of giving you the reasons why they're asking and letting you know. So that makes a big difference.
Yeah, absolutely. So why am I collecting this information and how is this information going to be used? So even though I'm not having necessarily a conversation with the client who's sitting in front of me around this, the information is still present on the form. So they know what kind of information we're looking for, in this case, legal information, and why we're going to use it. And then it's followed directly by, how would you like us to refer to you? Right. And then yes, LaShonda, it also collects the social security number, which in this case is again for the insurance purposes. So it's outlining why the information is collected. It's collecting legal and current information. It asks pronouns. It doesn't ask about gender identity because that's not what this portion of the form was about. That was farther down in the form. But it is something that's asked about later in the form. And then this would be something that we could ask every time at a visit as well, right? Because we want to make sure that if there's been legal name changes, if the current name or pronouns have changed over time, then we're able to collect that information. Or if like legal gender marker has changed, then we're able to collect that information. So this would be collected every time. Great job, everyone. So I'm going to these are two examples of how we could collect SOGI data, specifically around gender identity and sex at birth. And so or demographic information is also the way generally this falls under like a demographic space. So you can use a more robust list like the one on the left, or you can use something more condensed like the one on the right. Why do you think it would be helpful to have a more robust list?
It can promote a more inclusive and affirming environment.
Yeah, so Gray and Mariah said it's more inclusive, it can promote a more inclusive environment. Why else? let's say I was doing outreach and I was working in a park and I was approaching folks around sexual health education, or I was approaching folks for vaccine clinics, or for some reason I was out in this park and I'm talking to folks where privacy might be limited. What is If I have like a list of identities, then if folks aren't able to verbalize, or there's fear that other people might hear what's going on around them, then they're able to potentially point to an identity that matches their identity, or to just mark it. So that could be a way that it helps us to respect confidentiality for the person. The other thing is that because trans people and the trans and non-binary community are not a monolith, if we're serving a lot of trans and non-binary people, it might be helpful to have a lengthier or more robust list of trans and non-binary identities that match the identities that we're seeing most frequently in the clinic. So it's a way again for us to be inclusive, but also to work with the community that we're serving. What about a more condensed list? What would be helpful to have a more condensed list like the one on the right? Yeah, Mariah. So data collection would be easier. Why else? Or like aggregating it. Yeah, aggregating it would be much easier. Absolutely. We might be able to say, well, we could also like condense the list, the more robust list, if we didn't have a lot of respondents. But it would likely be easier to collect the data from a smaller list of potential options. Why else? So another reason why we might have a more condensed list or have a smaller question around this as well is if we're not serving as many trans people through our clinic, then we might see less diversity within responses. The other thing is that if this is part of a very large form, then it might be very difficult for us to have all the SOGI data fields and have all of these different responses listed. We might receive like form burnout, or folks might have trouble filling it out as a result of that. So if this is a much longer form, then it might be more appropriate for us to have more condensed list and ask things like, do you identify as trans, transgender, transsexual, or have a trans history? Because generally folks who do identify as trans or are questioning their transness are more likely to answer yes or don't know or unsure. So it gives us an opportunity to look at transness a little bit similar but different from gender identity, because then if someone says that they identify as a woman but have also a trans experience, then we know that they are trans, even though their current identity is woman. So now I'm going to share a little bit around health histories. This is another one that I think we saw pretty frequently. So the question was, is transsexual correct language? So there's a couple of ways that I like to respond around this. So um, remember at the beginning when I mentioned, think about the ages of the folks that you're working with. Think about the backgrounds that folks are coming to you with. If we're working with folks who are in their late 50s, 60s, 70s and are identifying as trans, then they may use language like transsexual to describe themselves, because that's the language that they had to describe themselves as they were coming out and figuring out their identity. So folks might use the language transsexual to identify themselves. So we want to reflect that language. The other piece is that there are folks who have medically transitioned who say that they feel distinctly different from just being part of the transgender umbrella community, because they are like part of that umbrella still, but identify as transsexual because they've gone through medical transition. So in this instance, it's less around us trying to police the language of the person, and more so around trying to just reflect the language that they use to describe themselves. This is something that, as someone who identifies as transgender and came out at a time when there was more language to describe myself, um, has been challenging for me to figure out as well. Because a lot of the language I was hearing at the time was, if you're not transsexual, you're not trans. And so there is like inter-community conflict around it sometimes as well. So the best thing that we can do in providing services to the folks that we are seeing is reflecting the language that they use. Awesome. And if that didn't answer your question fully, if another question came up because of that, feel free to put that in the chat as well. So now we're going to take a look at some common health history questions. So here's a snippet from a health history form. So thinking about the trans people that you may serve and their backgrounds, what are some things you notice about this form that might need to change? And if you're unsure what would change around it or how it would change, you can put a 2 in the chat as well. And that's okay. That's why we're here. Yeah, Bianca pointed out and Mariah pointed out one of the challenges, females can be changed to person who menstruate. Absolutely, because we know that not just people who identify as female, not just people who identify as woman, might be experiencing menstruation. Absolutely. Or be in need of a cervical screening. And then Bianca, the partners option as well. Yeah, absolutely. So we know that there are more gender identities than male or female. And this also so if we're thinking from a sexual health perspective, if we know, if our data is already telling us that that the patient or client sitting in front of us is male or female, and we're only asking about if partners are male or female or both, then we're already making assumptions about the ways that folks are engaging sexually, which means that we're also making assumptions about what kind of testing folks might need, what kind of reproductive health challenges, not challenges, reproductive health needs folks have. Um, and so we're making a lot of assumptions about the ways that people are engaging with other people. And so if my legal gender marker is male and I say that my partners are male, but it doesn't specify cisgender or transgender men, then there might be assumptions that I don't have need to discuss things like a contraception method, or I don't need to discuss reproductive health. But if I have transmasculine partners and and they're able to reproduce and I'm able to reproduce, then there is still a need for us to have conversations around the ways that we might need to look into contraception. So we're missing pieces when we don't ask in more detail. I'd really encourage us to move away from language like, are your partners male, female, or both? And instead ask questions like, what is the gender of your sexual partners? And if someone says male or someone says female, then asking a little bit more, have you had any trans male partners? Have you had any trans female partners? Because then we can get an understanding of what risk reduction can look like. Awesome. Great job, everyone. So this is another another portion from a separate form that's from a larger lifestyle survey. And so in the interest of time, I want to just move through it really quickly. But again, the question is about menstruation history, and it says if you're male, skip these questions. So if we're doing this on a paper form, then it may be that folks are savvy and they're like, well, this still applies to me. I might still fill it out. But if we're doing electronic records, if we're doing an electronic survey, we may have already filtered out these questions based on how someone answered their gender. And so if we've already filtered out these questions, then the assumption is this person isn't at risk for menopause. This person isn't needing any sort of or taking any sort of hormone replacement therapy or on any sort of hormone contraceptive. And then the final thing I want to share with you all in terms of forms is when we're thinking about collecting health information, especially in our electronic health records, and why we're collecting this information is oftentimes to make sure that we are providing health services to folks based on what their experiences are and what we know is indicated for their health. So who here has ever heard of an organ inventory before? If you've heard of it, just go ahead and put a 1 in the chat. And if you haven't heard of it, put a 2 in the chat. Okay, cool. So I'm seeing some 2s. So an organ inventory is an anatomical inventory that allows clinicians to document and track the presence or absence of specific organs, along with any surgical procedures in order to better guide patient-centered care. So this would be very specific to clinical care, right? We wouldn't need to necessarily do an organ inventory if we are providing providing social work services or case management around medication adherence or pieces like that, we might not need to do an organ inventory. But if we're working with a provider around medical care and we're assessing for things like regular cervical screenings, breast exams, testicular exams, etc., then we might want to do an organ inventory. So this provides improved care specifically for our TGMB clients, but can also be helpful for cisgender clients in documenting and understanding specific health needs based on the organs that are present or absent in the body. So if someone's had a hysterectomy, even cisgender women who have had hysterectomies, then we know whether or not a cervix is still present or not, that a cervical exam might be necessary. And we know that hysterectomies don't always remove the cervix. So there are ways that this can be applicable to cisgender people as well. An organ history would be completed while doing a clinical history and physical exam. So it's just part and parcel of what's taking place for that clinical history. And then it gives us a better understanding of how to discuss sexual history and preventative care. Because if someone has had any sexual reassignment or gender affirming surgeries, then we might not recommend specific ways to provide prevention, right? So if someone no longer has a penis, then we wouldn't necessarily say, to use a condom in this certain way, or we might advise differently based on neonatal vaginal tissue. And then this also can expand to identify past surgeries for intersex people, such as clitoral reduction or repair of I can never say this word, hypospadias. So if folks have experienced intersex surgeries, then this also gives us more information as providers as to what we might be on the lookout for in terms of medical care and what preventatively we might be needing to look out for. This is another example of an organ inventory. I believe this one is from Epic, for folks who are familiar with the EHR Epic. And so this would be just like if there's something present or not present. And you can see that some of these pieces like breast augmentation and implants are not solely for trans and non-binary people. Lots of cis women also get breast augmentation or implants. And so there might be additional health considerations for us to keep in mind for folks, and knowing that that surgery has taken place could be helpful. If you want to learn more about organ inventories and some of the ways they can be used in your EHR, I'm going to drop a study in the link in the chat. And so you're welcome to take a look at it and just see what might be applicable for the EHRs you're working in. And then the final piece of this, I'm going to say, are just a few additional recommendations. So we have gone over a few forms, a few data collection spots where we may be gathering information. Here are some additional recommendations. So fill out the form. If you have a form, fill out the form as if you are the patient. So put yourself in the shoes of a trans or non-binary client and fill out the form yourself. Think about what folks might be trying to add or subtract from the form, what might be unclear. This can often help us illustrate some of the issues we are going to have in collecting information right away. The second is standardize asking all clients SOGI information, not just those that we perceive as trans and non-binary. We've already mentioned this a couple of times, right? So standardize it based off of the clients that you're working with and the people that you see. And then allow for regular updates to that demographic and legal information for your clients so that if there are changes, we're collecting that information. Finally, identify where and how your clinic uses the information. So the systems, the processes, the records that use name and gender data, and make sure that if you change it in one system, that it updates in other systems. And if it doesn't, to be clear with the client or patient around that as well. And then train your staff how to collect this information. So one of the biggest challenges with collecting affirming data is that not all staff feel comfortable collecting it or have the language to collect it. And so if we train our staff in how to collect this information, in how to ask for pronouns and how to explain what pronouns are, in how to explain the difference between gender identity and expression or sex at birth, then we're more likely to get accurate information as opposed to that information going uncollected. So I'm going to open it up now for questions. I know that we are at time, but I want to give the opportunity, if there are any questions that came up, to please ask those. I'm going to drop a couple of a couple of links in the chat as well. So this first one is more information about organ inventories. It's a research study about how they can be used. And then this next one is a link to my mailing list. So every week I send out a newsletter that includes a resource for trans and non-binary clients or patients that you can use or distribute in your clinic or with the people that you're working with, or just keep in your back pocket in case someone needs financial assistance for gender affirming care. Then you'll have that available. So that's the link to that. And then if you're interested in the master classes that I have upcoming, here's the next master class, which will be next week. And so that's a link directly to that one. So that's just some additional resources for you all. I hope that this has been helpful, and I'll open it up for questions. Any questions that we have? Thank you, Gray, so much. I'm gonna stop the recording as well. So thank you all so much for being here.